Healthcare providers are faced with shifting day-to-day challenges. In light of COVID-19, our practices are dealing with a whole new normal. I want to share with you today how my practice is adapting to treat patients virtually during this pandemic. We are faced with mandatory closures all across specialties. Our children are home, schools and businesses are closed. If we have a high rate of cancellations and no-shows, how do we manage that? How do we turn it off? And more importantly, how do we turn it back on when we come out of this pandemic? How do we manage extreme patient volumes in all of our medical practices everywhere? As a founder of Health Latch, I work with babies and their moms who are struggling with breastfeeding issues because of oral tethers like lip, tongue, and buccal ties. How do I reach my young, tired families? It's a difficult time right now, as we all know. Communication is key internally with our teams and externally with our patients. A key limiting factor as I started the practice was the overdependence on the phone. We have our teams calling high volumes of people who are in a generation that really no longer use their phone. I didn't really realize at first that it was really inconvenient for them. It was really inefficient for me, and sometimes inconsiderate and ineffective to get my mission and my vision and my brand across to all the clients that I wanted to serve. That was an epiphany moment for me. No one really wants to use their phone anymore to call or to leave a voicemail. They just simply text. With Rhinogram, I don't use the phone at all in my office anymore. Our voicemail simply says, "We communicate by text message." And our website pushes the same message. Good leaders have a consistent system that they follow to voice how their brand is going to make a difference to the world. We do it by text. As COVID-19 hit across the country, practices are screening patients face-to-face. A team member is in contact with a patient, taking their temperature and asking their questions. Well, this poses a risk to that team member. The Rhinogram we use can screen patients virtually and text them with pre-screening questions. My patients get a text about 15 minutes before they arrive, asking them to stay in their cars until they're ready. They text us and tell us that they're here, and we text them when we're all done with the last patient and ask them to come upstairs. When they're escorted out, we wipe everything down and we have the next family come in. This has given a reassurance to the families that we are taking this pandemic seriously. If I were to give you any advice, this is not a time to duck. It's a time to positively shift your habits as a professional, to leverage technology to safely screen people before they come in and ask them to wait in their cars if necessary. Families really understand that. I love the text we receive after saying, "Thank you so much for all you're doing to stay open for our babies." So it's a really big win for me, and I know it will continue to be in the future.